I was thinking all those guys came home being booed a lot of times. I want you to remember how tough it was when you were in Vietnam, what you did, what you had to do, and how important it is now for you to remember that toughness and go through it, because you still have a lot to give and people have things they can give you, right? We've earned our way. Get ready and use it.
Right. 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 Right.
I found the Raleigh Vet Center. It's like a lifeline. You know, I know that I can reach out to any of these guys if I'm having a problem, and they all have the same problems. That's the difference. So anybody that's experiencing that out there, reach out to your local vet center, find a counseling group and talk to them and tell them what you're doing, because guys, we all have the same problems. We do. I mean, it's whether it's 40 years ago, 30 years ago, there are people to help us out here, and you can live a normal life. And if you need to reach out to somebody, you have that brotherhood where you can do that. So I encourage you to do that if you're having problems, struggling, or anything like that.
Right. 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 Right.
You ain't gonna get stuck on only the military. Military is great, but after that life, there's another life, and then you can continue to be the human being that you are right now, and then you can follow and seek for another future, a better future. Follow your heart. Don't just follow the intention you want to do. I mean, just be resilient. I mean, if you need anything, let me know. I'll be there. I mean, I'm jumping the cars. Driving around, going to their houses. Hey, I'm here for you. Find somebody that you trust, talk to them, let them know what you're going through, and somebody will be there for you all the time, understand you, what you're going through. I mean, somebody's always there for you.
Right. 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 Right.
I'm glad I got through that one, you know, and glad to be here today to tell the story. You know. Don't give up. I mean, there is help, you know. You got a handful of folks that, like the folks here with Veterans Court, you know, when you got folks that are doing it, you know, without pay, you know, or just trying to make it happen, there is help. So don't give up, you know, don't give up, you know. I mean, I just want to stress it, don't give up.
Right. 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 Right.
You got to get out. You got to get out your comfort zone for one. You know, I know we all dealt with different things. We all understand different things. So just get away from it. Just try to get away from it. You know, just try and just know that, you know, it's much bigger out here. There's always so much more to live for. You know, and just give it your all. There's no reason to give up. You didn't give up while you was in the military. You wouldn't never give up on your brothers and sisters at home. So don't give up on yourself.
Right. 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 Right.
It's hard for me to talk about because it's so personal to me. World War II, they came back as the soldiers came back as heroes welcome, ticker tape parades and everything. When the soldiers came back from Korea, it was kind of indifference. It came back to indifference. By the time we came back, that indifference had turned outright aggression against us. That caused a lot of suicides. If you're down to your last minute and you can taste the gun oil in your mouth, stop and call somebody. If you don't, tomorrow's not going to be better. If you don't wake up, it's not going to be better. So it'll get better. You can do it. If I can do it, anybody can do it, because I was so far down. You can do it.
Right. 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 Right.
You have to dig deep inside yourself and determine whether you're going to let another outside influence the rest of your life, or whether you got enough gumption. It's a hard and bitter fight. It's not easily done. I am a believer. And because of that, I want you to understand. And you can believe or not, that's not my course. I'm not telling you to believe, I'm telling you that I am a believer, and I will always say that. And I want the other people to know, if they want to get away from this addiction and they want to get away from the pressures, come to the cross.
Right. 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 Right.
First, just want to voice that I completely understand, and
anything I can do. Take away to some seats. We'll get started with this wonderful afternoon session of the North Carolina Governor's Working Group in just a moment. Been a little bit. Good afternoon, everyone, and welcome to our April 25th, 2019 North Carolina Governor's Working Group.
Start the meeting.
On veteran service members and their families. Before we get started, if I can just ask, is there anyone on the dial-in, and can you hear us? Hello? All right, well. Wonderful. And then, if we can get started here, I would like to thank our hosts at RTI very much for hosting us all day today. We had a wonderful session this morning working on veteran suicide reduction and some fabulous initiatives that are going on here in North Carolina. We're going to get started right off the bat. I'd like to let Secretary Hall to make a few opening remarks to get us started here, and then we'll go through the Vice Chair's updates, and then Dr. Lane and I will introduce you all to our program for this afternoon.
Please wait for the moderator to start the meeting.
Are we waiting on?
Yeah, we're good.
Okay, I'm trying to follow directions. Good afternoon, everyone.
Good afternoon, sir.
I don't know if we have a mic somewhere, or this is all dependent upon us. That's fine. Yes, sir. Okay, well, I'll talk to you like you're Marines. I'll talk to you real loud. No matter what the response is, I'll keep talking. So,
That's a little too fast for me. I'm a Navy.
Whoa, I don't know what to do with that. And we were relying on y'all to get us to the shoreline, so I don't know. But welcome to the meeting. Certainly we appreciate everybody taking the time and continuing to be involved in networking on what these issues are as we go forward. We know this issue in particular for this month is extremely important, and of course it's affected by what else we do and all the other infrastructure we have to support veterans, to interact with them and their families, and to make sure our total state understands the benefits that come from having a strong network around those in need, whether they're veterans, members of their families, or just members of our community at large. So the lessons we learn and the collaborations we do should certainly be shared. And if we're doing something or saying something that you either take issue with or have experience with solving that problem and making greater impact, give it to us. Tell us. Say it. I like to say, as I justify my existence many times, that even a broken clock is right twice a day. So if you listen to me long enough, I'll say something that's correct. I'll give you a quick example and I'll get out the way. We're building 2 nursing homes here in North Carolina. We have 4 already. We have a special needs wing in each one of them. We're in the crunch of trying to get a budget done. And we've got construction company versus the construction manager. Construction manager, of course, gets paid if the project comes in on time, gets paid a bonus if the project comes in on time and under budget. Construction company gets paid. And so you have 2 different views about how to do things and on what schedule and what is the reasonable cost. And there's always a disagreement there. But we have to put every idea on the table, and that's what the meeting was. And let's work through, and it may be a different idea at the end of the day. So I want to encourage you, if you've got something that works, something you heard about, something that someone else is doing, or you take issue with some of what's being done now and have suggestions, because you got to identify the problem and help us solve it, then we're all for it. And I want to encourage that as we go through this issue as well as other meetings we have. If you've got an idea, you've got something that works, you heard about it, you see something we're doing that could be done more efficiently or effectively, or any of the partners in the room or in the group, let's put it out there, let's learn, and let's be more effective at what we're doing. So thank you so much.
Thanks, sir. Deputy Secretary Westbrook, I believe, has some updates for us from the Department of Military and Veterans Affairs.
Thank you. I'm here representing Martin Falls. So he's off in Asheville and visiting some of the out west veteran services officers. The biggest thing we have is some of the events that are coming up. Highlight a few of them there. Number one, this coming weekend in Wilmington, we have one of these Veterans Experience Action centers. They've got about 9 veteran services officers going to be there. They have several hundred veterans they're expecting to come through Wilmington, do a lot of work with the VA, a lot of overall stuff. So it's a good event if you have to get down there for the weekend. As you see, the month of the military child is closing in now. We have a big ceremony coming up next week where we had a contest. We have several videos from some 3rd graders around military communities that are going to be shown next week. We voted on them, and they're all going to get recognized for putting together a little 1-minute video of what the military means to me and as a class. So they've done a real good job with that, and that's coming up. May the 10th, we're celebrating Military Spouse Appreciation Day down at the Contemporary Arts Museum. Event that evening from 5:30 to 7:30, so part of the month of the spouse. So that's also something else coming up in there. As you see, we have the National Veterans Legal Service Project training we put on that board. We've got some people from the VA coming in on the legal side. The folks that actually adjudicate claims are coming to give our veteran people some in-depth training on what it takes to get a claim processed, what it takes to get it documented properly, and make sure our people know all of the legal side of the claim process as well as all of the physical and disability side of it. That's some of the events coming up. Obviously, there's lots more. Next month we'll have more even than that. So, we'll keep that updated on our DMBA website. You can find that anytime. We also have some folks from Charlotte and other places that provide us a lot of input. So if you have any events you would like the DMBA to highlight, please feel free to email us. I'd like this put on there, and we'll make sure it gets captured on our list of things going on. Thank you.
Thank you very much, sir. Now I'd like to introduce my boss, Deputy Secretary Cody Kinsley from North Carolina Department of Health and Human Services. He is the gentleman that makes all of this possible every month. Sir?
Thank you, Jeff. It's good to be here with you all today, and I think everyone knows that Jeff is the boss. So he keeps us in line and keeps us doing this good work. So to start off, I just wanted to really start with our vision for behavioral health in North Carolina. And I'll read that first part to you. North Carolinians will have access to integrated behavioral, developmental, and physical health services across their lifespan. And I really want to double down on the word integrated, right? That's integrated in a physical health care setting. You know, I think many of you know people that need behavioral health supports, especially our veteran neighbors, friends, family members, and our military families. They're not going to put their hand up sometimes and walk into a behavioral health care clinic and ask for help. Some will, but many won't. And the key part of integration is not just about making it easier to access, it's truly making it more likely to access, right? And so we're trying to be really creative in how we integrate services in all of our programs. And having Jeff on our team helps us make sure that everything that we're doing in the Division of Mental Health with all of our partners and across the Department of Health and Human Services is really thinking about how do we integrate veterans into those programs in a very thoughtful way to get access to those services. So I think that this is a critical part of how we think, and it goes back to what Secretary Hall was talking about, how do we really partner around things in a very ambitious and creative way. So I want to give two updates to some specific programs that we've recently rolled out so that you have an awareness of them. The first is, I think many of you know that unfortunately last fall was pretty treacherous, the hurricane season on eastern North Carolina, and that has become a recurring event. And with Governor Cooper's leadership, we have really been doubled down as a team, the entire administration, to make sure that we're bringing true recovery and resiliency to those communities. And a big part of that is addressing the behavioral health needs and resiliency for those communities, right? It's really hard. You imagine you've lost your home, perhaps you've lost your home twice in 2 years, you're trying to rebuild, you're scattered from your family. It's an incredibly tough place to be, and from a mental health perspective, it can be very hard to get back to a place of stability from that. And sometimes you don't know that you're really struggling with it until it's very far out from the storm, and so then everybody else around you seems like they're recovering and you're not. It can be a very difficult challenge. So I was really proud that our team this year doubled down on a different strategy to address those concerns, and we've gone after a grant called the Crisis Counseling Program. What this grant is, and we've done it in years past, where people go door to door and provide on-the-spot outreach, resource referral, and actually on-the-spot therapy and counseling for those people. Right? In years past, it was a little bit more of a lighter touch where people got referred to services, maybe left a pamphlet and asked a few questions. And I challenged my team to think a little bit bigger about that this year, and I'm really happy to say that we've come back with a program 5 times the size of what we've done in years past. And so that's resulted in this grant, which is over $12 million, and the total grant for a year will be over almost $15 million. We've already had almost 100,000 touches. And these are actually, not only is this a on-the-ground outreach and counseling program, this is an employment program for local providers who maybe have lost their places of station. We know where all of our bases are and making sure that they're getting access to services. And then we've also built the infrastructure, not just on the ground for the door-to-door, but in our DSS offices, working with individuals in the Department of Public Safety and Emergency Preparedness, working with other local county government folks to make sure that folks are getting plugged into services, whether they're at the VA or otherwise, that they would need. I can't say enough about how great this program is. I'm really excited. We're seeing the uptake in a huge way in every single one of the counties, and we'll continue pushing it. It's already referred over 5,000 people for more intensive behavioral health services. We found people that probably would have never put their hand up for asking for help, right? Now, of course, part of that is we have to figure out a way to fund those services in the long haul, right? So we'll continue to advocate for services for individuals that need behavioral health needs. And I have to just pause because she is in the room, but Susan Robinson, who's hiding in the back, probably on purpose, everybody look at her. She is the force behind this program, and she has made it run and has had fought battles upon battles with us. She took on the federal government and won, and so we have to give her a lot of credit. On the next slide, I want to talk about something that I think many of you know about already, which is our partnership with Unite Us and NC Serves, which is a phenomenal resource referral program that, and really a network of services. And what's exciting about this is not just the work that we're already doing and we're already funding across the state to build these networks around veterans and military families, but is actually broadening it. The department has selected this platform as being our true resource referral for social determinants of health across the state. So North Carolina received an unprecedented grant from the Center for Medicaid to take $650 million of what has been classically Medicaid health care dollars and use that money on things like housing and interpersonal violence support and a variety of other social determinants of health, things that give folks the opportunity to be healthy. And part and parcel of our strategy in building that out is leveraging the Unite Us platform, which is the underpinning of NC Serves, to then grow this platform statewide, right? And the way this works is that when you go into a doctor's office or a community service provider's office, or it could be anyone, some sort of neighborhood service provider or something, and you flag that you have a need for housing or a new mattress or a concern, this system helps get you connected to those services. And the fact that we can use Medicaid money, which has classically only been for when you go to the doctor, to pay for some of those services is a huge game changer. And our theory is that when you spend money on things like carpet in a child's home, that helps asthma, and it also helps people from not going to the hospital, right? And when you spend money on housing and supports for a veteran that's struggling with behavioral health needs, you're going to save money in the long run by investing in those things that help people be healthy. And so I'm incredibly happy that a huge effort that has grown out of Unite Us really started here in this group and the investment in NC Serves, and we could not be more lucky to have them as a partner in doing this work. So we'll continue to push forward on that. And you can find the RFA on our website about the whole pilot regions that we're pushing around this and the healthy opportunities.
Thank you, sir. And sitting in for the folks from the Vero and Winston-Salem, representing Mark Vilos and Brian Ward, we've got Mr. Michael Howard.
Hey, how's it going, everybody? Good afternoon. On behalf of Mark Vilos, we thank you guys for inviting us to the meeting this afternoon. We have a few events that we have going on for this month as well as next month. As colleague here was talking about, we have our Wilmington VAC going on currently, started this morning. Over the next 2 to 3 days, we'll be finishing up there on Saturday at 2 p.m. So if you have any veteran organizations in that area, veterans in need of direct services with claims processors and other organizations in support of veterans claims, refer them to that location so they can get their claims worked and adjudicated and reviewed by somebody in person. I think our VX has been extremely successful. This will be our 4th one for the fiscal year. We've already visited Charlotte, Greensboro, Goldsboro, and this is our 4th one now in Wilmington. So we really look forward to continuing these veteran experience action centers around the state and taking our services into the community. The other thing that we have is our faith-based workshop that we're going to have for the month of May. So May for us for the compensation services is faith-based month. So we want to have in Winston at the Goodwill a faith-based workshop. So the intent of it is to get our religious leaders or faith-based organizations to come out to this event in support to gain some information regarding veterans compensation services, VRE services, and different benefits that they're entitled to. Because a lot of times that we've learned is, the veterans are referring to their faith-based leaders firsthand when they have situations. So to provide that firsthand education to these leaders will help us provide our message even more into the community. So again, we're going to have a workshop in Winston. It's going to be kind of round robin over a period of a few hours. We'll have different rooms set up for different compensation benefits, so you can go in and learn about different things. If you guys have any interest of people within your communities that may be able to attend, please reach out, let us know. We've sent emails through the governance work group distribution list. If any of your organizations needs to be updated with personal with information for some of your contacts, I would ask you guys to kind of update that to ensure that we continue to get information to you guys. We've been imploring the distribution list from the governance work group to kind of send out some of the events that we have within the community. So A lot of our touches are through those contacts right there. So if you have any other questions about any outreaches that we have going on, please refer to the website for the regional office where we post our events daily. So.
Thanks, sir. Next up, we've got Dr. Daniel Deeker, our newly appointed, first-time visiting Deputy Director for Vision 6, and I believe he's also one of us. He's North Carolina National Guardsman, right? Welcome, sir.
Thank you. So thank you very much for the opportunity to be here today, representing Ms. Seekins. Maybe you're more familiar with her attending these meetings. As you mentioned, so I have some roots here in terms of serving in the Army National Guard with the North Carolina Guard back in the 80s. So it's a familiar turf to me. I'm actually coming from the state of Maine, where I was Associate Director at a medical center up there for the VA, been with the VA about 10 years. So I wanted to take the opportunity today just to make a couple comments related to the Mission Act. As many of you may be aware, Congress passed the Mission Act about a year ago, so coming up on June will be a year. And so post-June 6 will be the implementation of that, the law that the Congress passed. So we are working, I will say, very feverishly right now within the VA leadership in the state of North Carolina. In fact, tomorrow we're having leaders from all over the medical centers in North Carolina into Durham, where we're going to have a focus group in terms of our communication plan to make sure we get the information right and get it out to all the groups at the local level from a facility perspective, medical center directors and their PAOs. So there'll be a lot of information that will come out more specifically to that related to some YouTube videos. The whole campaign will roll out, but I just wanted to touch on a couple things related to what's going on currently. So Care in the Community Network, we continue to grow that. We're working with an agency, a third party, if you will, Tri-West, to continue to grow the network of collaboration with community providers across the state of North Carolina. And in fact, before I came over today, I just got a briefing from Tri-West related to that. And they've really closed the gap for us a bunch, I will say, related to specialty care providers and how we in the VA, we don't have the ability to have specialty care providers in each and every one of our facilities. So how do we network with the local community? And they're doing a fabulous job of closing that gap. They brought to us in that partnership a capability that we don't have within our own program, so it's been a really nice partnership. So making strides there. And again, one of the emphases that we're looking at in terms of markets. And when I say markets, I think of Fayetteville and Durham kind of share some similar providers in Raleigh, perhaps. Between Salisbury and Asheville, they share some providers in Charlotte, perhaps. And to look at that from a market perspective and not just a medical center perspective. So I think we'll get some gains there going forward in terms of being able to meet our veterans' needs where they live versus having them travel throughout the state to get their care. We are making I'll say a transition too, but we're really putting some emphasis on a high reliability organization. And you might say, so what does that mean? And if you're in private industry or private business, you might know a little bit more about it, but it's really the concept of zero harm. And so you look at a healthcare agency and you're like, you're trying to do zero harm, we expect you to do zero harm. So we expect it as well. But we're not perfect, we're not a perfect system. And what we're doing from a leadership perspective down to the point of execution or the point of care is really spending some time focused on not so much holding people accountable to fire them, but how do we hold people accountable to do the right thing, to take initiative at the lowest level and making the right decision as they interact with veterans and trying to get them the care that they need. And not worried so much about, is it right or is it wrong? Is it the right thing to do? More about that. And where I think you'll see the difference is those one-off bad interactions you might have on the phone or with a clerk at the front desk of point of service, you'll start seeing those go away. Because, we're just interacting with them more and setting expectations. Modernization, I will tell you, if you've been around the VA or paid attention to the VA, one of the things that we struggle with probably as much as anything is hiring our staff. I don't know if any of you worked for the VA or ever tried to work for the VA. From a healthcare perspective, is the length of time it takes to hire folks. So we have more centralized that and tried to debug it in terms of getting rid of some of that timeline that it takes so long to hire folks. That's part of the modernization effort at the central office, but we're actually executing that ahead of schedule within North Carolina. How we advertise, how we recruit people, and how long it takes once we've made an offer to get them into our facility. So that's a very focused one. We're just finishing up in North Carolina the market assessments. And so just to give you kind of a glimpse of market assessments, we've actually spent time in the Asheville market, in the Fayetteville market, Salisbury, and the Durham market to figure out what is it that we do well that we want to do more of and do better of, and what do we need to do in terms of the care in the community, partner with community partners better. Maybe there's some areas that we don't need to grow in the VA side, but we need to partner with Duke or UNC or other local providers to do. Knowing that we can't do everything for all people, what do we do well and how do we invest in that for the long term? So those are some things that are going on immediately. I got up there from a news perspective just related to the Sanford Health Partnership. Just wanted to mention that real quickly. That partnership is happening at Durham right now as part of a pilot. And what it is it's doing DNA gathering on a voluntary basis of veterans who want to give their DNA. And the focus there is new and creative ways to do healthcare and treatment for folks. Sometimes we can match a certain treatment regimen or medication based on the DNA makeup of somebody. So I may be different than him, and we know that based on our DNA, and we can do a treatment differently. So we're part of a pilot program. Eventually, we think this will roll out across the country and be an option for all veterans. As a veteran myself, when I was active duty, the government had my DNA, right? Just anybody who was on active duty. But for many of our veterans who may have been off of active duty or not serving at the time that the DOD had that initiative, it's now an opportunity to do that specifically as part of your treatment regimen. So it's an opt-in. It'll be a conversation that you would have with your provider, and then again, we look at that to grow a little bit further. But just wanted to mention that as an initiative that's going on. And new hospice facility in Durham, we actually did the groundbreaking on that. I think it was last week or the week before. Really beautiful facility on the first floor on kind of the northern wing there. And again, best way to take care of our veterans towards the end of life and their families and servicing them. So we're really happy to have that facility back open there at Durham. And that's all I have in terms of the formal stuff, but certainly I'll be available for any questions.
Thank you very much. Thank you very much, sir. And before we move on to Mr. Edmonds and Workforce Solutions, I just want to throw in for another update that the VA Southeastern Valor Games will be held in the Triangle area from May 20th to 23rd at UNC and Duke campuses, just for folks who would be interested in participating in that. And Moses has all the details. Mr. Edmonds, sir.
Good afternoon. On behalf of Secretary Tony Copeland, Secretary of Commerce, greetings to everybody. It's good to see everybody here. A couple of things that we want to update you on from the Department of Commerce. The first VETS audit, the VETS program, Veterans Employment and Training Service. That's the federal program that funds our close to 70 veteran staff that are in the 80 NC Works career centers across North Carolina, and focus on serving those veterans in most need, those veterans with significant barriers to employment. We get audited every 3 years, so the feds came down and audited us. Not only were there no findings or observations, but North Carolina was actually cited as having 13 best practices, documented best practices, to share across the Southeast and the nation, the way we support veterans. So I want to highlight 3 of those for you. First, the veterans specialists that we have in the offices are DBOPs to support veterans and their active integration with veterans courts. And we recognize that getting a veteran a job is a key arrow in the quiver of local district attorneys who have the veterans courts. So we're proud to be a part of that. It's not everywhere in North Carolina, but where there are veterans courts, we're integrated to give other options to help our veterans that are having those type of issues. Another one is having a full-time veteran specialist at the Asheville-Buncombe Community Christian Ministry, ABCCM, out in Asheville, a 250-bed facility that many of you are familiar with, the Veterans Restoration Quarters, and we've put a full-time veterans program specialist there to assist those residents, again, in getting jobs, getting training and getting jobs as a critical component to them getting back to where they need to be in society. And another one is our active integration in the economic and business development efforts. This one specifically was Catawba County, and working with the economic development leadership there to not only highlight to businesses the benefits of hiring veterans, but also highlighting to veterans that area of Hickory and Catawba County and the benefits of moving there. So we've had some active initiatives going on that have been very successful for that area. So we'll see the feds again in 3 years, and in the meantime, we'll continue to refine our processes. In North Carolina for military employment, NC4Me, you can see the list in front of you, or the schedule in front of you. Some things just to highlight. The first is beginning April 30th, going through May 3rd, is a virtual hiring event focused on military spouses. We've recognized that that's a gap, and where there's a gap, there's an opportunity, and it's to help those military spouses that find it difficult to find employment because they move around needed, and then the employer and the spouse go through the interview and hiring process virtually. Then you can see the next ones that are highlighted there are all centered on major military installations. And then last month I talked about the event in Charlotte. I just want to highlight that again. Working with Paul Bill from Veterans Bridge Home. That planning is ongoing, and that promises to be a very good event on September 11th next fall. And I wanted to follow up with you special focus events. Last month I talked about an upcoming veteran stand down with the Lumbee tribe down in Robeson County. There was a great success. Several people here, their organization supported. Paul Berry, NC Serves. Sir, thank you very much. You're always very supportive to all the events we have and trying to help veterans. We ended up having 174 Lumbee veterans and family members come to the event, 28 different service providers and 11 employers that actually conducted interviews on site for those that needed. So not only giving the veterans the help they need from various agencies there, but also handing out information on employment and actually conducting some interviews. So we will continue to look for special focus stand-down events like that across the state of North Carolina. And I'm available for any questions either now or after the event. I'll stick around if anybody's got it. Thank you.
Thanks, sir. And before I get started with our Governor's Working Group updates, I just wanted to give a moment to our host, Dr. Rebecca Lane, for hosting us and talk a little bit about this morning and RTI's involvement in veteran space because it's long and broad.
Everybody, thank y'all for coming today. Really appreciate it. If you were here in the morning, welcome back. And of course, welcome to RTI's campus. We are honored to host this meeting. This is the second meeting that we've been privileged to host, and we appreciate so much the work that you're all doing in this space collectively, and to the folks sitting in the front of the room, thank you so much. I'm the director of RTI's Military Behavioral Health Research Group. We do a broad spectrum of research with all types of military-connected individuals and their families, including veterans in that space as well. We work across behavioral. It's been mentioned many times earlier. This morning was especially, and unfortunately, necessary that we got together to talk about our suicide practices and collaborative to continue the work that's going on to end the numbers that we continue to see. So just appreciate everybody's being here and keeping to do that work. How to be able to support the folks who are on the ground in the communities doing this work. We don't do a lot of service provision directly to individuals, so we're happy to be on kind of the flip side of it, be on the back end to do any of the support, the data collection, the data management. That's our strong suit. So we really embrace collaboration and innovation as an organization. And some of the partnerships that we've been developing with this group over the last couple of years that we've been heavily involved have been really beneficial for us, and we hope that they have been for you as well. So I will be brief because I know that time always runs short at the end. Just thank you all again for being here, and come back anytime. You know where we are now.
now for a little bit of housekeeping, if you will, about what we do at the Governor's Working Group. Dr. Lane mentioned data, and we always like to have good solid evidence. This is a representation of the number of folks who have been gaining access to our presentations and our meetings via Facebook Live and our associated YouTube channel. You can see last month we had 4,200 people tune in to find out about veterans and Medicaid. Who knew there was that many folks? And so my point here is, though, that in the light of looking for new and exciting ways to reach people and get this information out, we've been really successful over the course of the last calendar year in expanding the breadth of folks that have information and access to the information that is shared here. And this is how we collectively raise the bar in the state of North Carolina, or give it our best shot. And here are some of the social media platforms on how you find us and where you'll be finding all of this information. We don't hide it in one silo. We try to get it out there as broadly as possible. And one of those on our subject today, very specifically reducing veteran suicide, is our helpncvets.org subcommittee of the Governor's Working Group. We've been working with folks from Campsite Solutions, or Campsite Communications, to develop some really effective campaigns with North Carolina veterans, urging other North Carolina veterans to seek help through the VA's system. Now, getting the word out and helping to lower the barriers to seeking care. And on that subject, so we have a suicide prevention task force that we have been working to put together for a number of years. And one of the reasons that's so important, beyond the fact of reducing suicide, is that we have 3 major initiatives going on in North Carolina as we speak, which is what we spent the morning discussing. We've got a major SAMHSA effort with our friends from Charlotte in the Veterans Bridge Home and Charlotte Mecklenburg Veterans Services. We've got a CDC team that has been working with our friends here at RTI with Dr. Cartwright and Dr. Morgan. And then we've got a VA and VISN MYRIC sponsored effort out in Carteret County on rural veteran suicide and reducing that. So there's a lot of activity in this space. When folks want to know why suicide in North Carolina is lower for veterans than in any other state in the Southeast, that's one of the reasons, because there's no shortage of vigor. On the subject of vigor, another one of our subcommittees has been the NC Strive Student Veterans Subcommittee. We just finished our 3rd of 4 regional conferences yesterday out in Craven County. And these are designed to link student veterans who are traditionally in that age group that has the highest risk to transition suicide with the necessary skills and tools to succeed. And also, a significant focus of this is actually the educators, so that they know where the resource guide is, what's in the resource guide, how they can get folks linked up with the services, where the NC Serves networks are in their communities to help fill in these gaps. Another one of our subcommittees is Operation Home. And please don't look at the website at the bottom. That's the website from the previous slide. But our Operation Home efforts for the last 5 years have been successful in reducing unsheltered veterans' homelessness by 14%. That progress is threatened right now. One of the gentlemen who led the way, our friend Mr. Jeff Doyle, will be moving on to a new position. He held multiple roles. I think he had 4 hats on, one of which was the suicide prevention coordinator. Another one was the homeless veterans coordinator. We are also down a state veterans homeless coordinator, and we would like to find the resources to put together a position called the by name list coordinator. We have 27 by name lists. That was quite a lift getting those established, up and running. So now we need somebody to work the lists and be able to make it to that next plateau to reduce veterans homelessness. So I truly hope that we can work together to find some of those resources in the future. And now, this morning, I think we're going to have a little, or right now rather, we're going to have a little recap with a friend and original founder of the Governor's Focus Group on Veterans from back in 2006, Dr. Harold Cudler, has returned to us from VA Central Office and spent the morning helping us to sort through all the initiatives. And we're going to talk a little bit about the gems that he's delivered and helped us find in North Carolina. And so, Sarah?
I thought Lee was
Lee always hides in the shadows.
I know that. I thought you got all these notes.
Well, thank you. Well, this is like one of those dreams where you're on stage and what was the script? What were we going to say? But yes, thank you, Jeff, and thank you, everyone. I really, having sat at the front table for this for like 10 years with Flo Stein, who's here, and her husband, Worth Bolton, who was at the table when Governor Easley first asked us to create something for veterans, service members, veterans and military families, and veterans families in North Carolina. This is amazing, absolutely amazing, and overwhelming. And on the one hand, it's always tempting to say, do more of this, do less of that, try this, or don't you remember this? And I can think of all these things we've done over the years that are great, that are kind of being repeated. Number one, I've kind of learned that's good that's being repeated. Institutional memory is a wonderful thing, but you can get stuck very easily. Part of the problem with dealing with an issue like this, we were talking about integration before, is that there is no end to that. And the challenge keeps going. When I was in VA Central Office, and I spent the last year as the Assistant Deputy Undersecretary for Patient Care, so that was like everything. But I'm only an Assistant Deputy Undersecretary. I had answered a lot of telephones and showed up at meetings and tried to look like I knew what I was doing. I began to wonder sometimes, well, we've got this Office for Suicide Prevention, but a lot of people who die by suicide are homeless. So how do we connect those two things? But a lot of those people have chronic pain and use opiates or are addicted to them. That's in a different office. How do you do that? Then TBI is a risk. That's in rehabilitative medicine. And before you know it, you're totally dizzy about, well, can I do anything? The answer is to gather at rooms like this, to keep making those connections, to find things that work, to do them and do them as well as possible. Many of them become part of the architecture of the structure without anybody thinking about that anymore. That's true success. One thing, we spoke today just to say, I'll try to summarize. I actually wrote notes too, but if I try to read them now. We had presentations from Jesse Morgan and Joel Cartwright, who'll be, I think Joel is coming back for this next session. We'll find out. But this is what happens. No script. But they're from RTI. They're here on vacation, by the way, on vacation time, which is very much appreciated. Oh, look at my notes for a minute. How much time do I have, Jeff? 4 hours?
Yeah, 4 hours. We could take a break. I don't know. Secretary, can you have to do good? I know some folks had some other conflict.
I'll keep it real short. They provided us the state of the science of suicide prevention. And, Becky was saying, well, RTI doesn't deliver services. Were it not for the kind of data that RTI pulls together, which then generates knowledge, there'd be no grants. There'd be no, hey, why aren't you doing this? That got published in a journal and you're not doing anything about it. And believe me, at VA Central Office, when the secretary comes down to talk to all the deputy undersecretaries and the undersecretary too, he says, this was in the New York Times yesterday. Why didn't anybody tell me about this? And that drives things more than the business you came to the table with. And that's actually a good thing because there is no end. No one person, no organization could manage all these details. One thing that certainly, so we talked about data, and we talked about suicide prevention in North Carolina and elsewhere. And one thing that does come out is they back up what Jeff was saying. North Carolina, among the southeastern states, has a much lower level. Now for me, before I go back to central office and say in an email, hey, Keita Franklin, head of suicide prevention for VA, formerly for DOD, North Carolina is doing something that's working. We have to be able to then tease out with data, what is it we're doing that's working? Or at least what correlates with what's happening here. I believe, as Jeff does, it's this process. It's the interconnection in this room. It's state, federal government, community, schools. Doug Taggart couldn't be with us today, but the work we've been doing in schools forever. It's the National Guard as a natural engine of pushing information into the system and bringing it back. We used to have a wonderful guy, the head of patient advocacy at the Durham VA, Jerry Corbett. And Jerry was a very senior officer in the North Carolina National Guard. And just, not officially, but unofficially, we learned a lot about the Guard, and the Guard learned a lot about the VA because we maintained those relationships. So we heard something about the statistics and the data, and it's looking good here, but of course, as anybody will tell you, one suicide is too many. And we talked about also the fact of the 20 veterans who die by suicide every day, 14 of them are not in the VA system. Something that certainly was important to me in VA central office when the secretary would say, the president just told me that I'm being graded on how I decrease the rate of suicide among veterans. Well, number one, the president didn't seem to realize that it would take us 2 years to know if anything we did today possibly had an effect on veteran suicide. So most secretaries don't last that long, so he was safe. That wasn't going to happen. He was never going to get a grade. But then we would look at it and say, hey, wait a minute, 14 of the 20 who die by suicide are not under VA care. So how are we in the VA? No, I'm speaking for myself and not for the VA. That the VA is taking a tremendous gamble with the Mission Act. The Mission Act could open up VA to connect with the community in ways it never did before and raise the level of military, cultural, and clinical competence, because it's just not there, as the RAND Corporation has shown, and our own work through this group has shown over the years. Most community providers never even know if their patients are service members, veterans, or their family members. That would be incredible if we can leverage it for that. But if it's simply us sending care out to the community, the providers who get paid by the VA but don't engage the kind of questions which this group and all of you here raise, like, hey, you don't have a job and your blood pressure is high. Did you know that we can help you get a job? Did you know that the VA, whoever set foot in Vietnam, who has diabetes and they're of an age when there's a good chance they will, is presumptively service connected for diabetes, can get all their medical care and all their medicines through the VA, which would open up all the other services of the VA to them. I mean, we're not sharing this information, not because we want to sit on it or hide it, but because we don't realize all the forums. And, well, anyway, let's keep going. We then had Janine McGee of Mecklenburg County Veteran Services and Dr. Nicole French of Veterans Bridge Home, a remarkable group. And she was here in uniform, but one thing that always gets me about Veterans Bridge Home is that in many ways it was created for the Special Forces community. And in hanging out with Tommy Norman in the early days of Veterans Bridge Home, and they used to come to these meetings, I worked in the VA for 35 years. I never much thought about the Special Forces community until I began to realize they have their own networks. They find each other in communities. They find jobs in housing, and they understand issues, and have been on missions that a lot of other people don't know about. But that's true of the military. Nobody, even in the VA, and certainly even in the military, know everything the military does. You could be in the same unit in the Marine Corps and not know everything that unit has done. So it's incredibly complicated. You can't get your arms around it, but curiosity and listening to people and then picking up on their ideas. So we heard about very successful programs going on in Mecklenburg County and SAMHSA's Policy Academy on Suicide Prevention, which they both spoke to. Laura McCarthy and Robert Kirk couldn't make it today, but spoke about the Carteret County Together with Veterans program. And this is a special program, and it's really funny. We have the Vision 6 MIREC, which is on deployment mental health and is kind of a flagship program. It refused to be a PTSD program because we have enough PTSD programs, but we didn't have a deployment mental health program. The Vision 19 MIREC, which was invented at the same time about 12 years ago, is a suicide prevention program. Now, in those days, nobody in VA was that excited about suicide prevention. If you'd like to know the truth about why we invented a suicide prevention program before it was on the radar, it's because the Undersecretary for Health, his father was a psychiatrist who specialized in suicide prevention. And in honor of his father, being the Undersecretary and having enough money to create 2 more of these centers, wanted to do something to honor his father. Now, that doesn't sound very official, but it turned out to be a wonderful idea. And thank goodness that we had that we had a running start on suicide prevention. By way of free association, just yesterday I was listening to an hour-long program at NPR about opioid addiction and the efforts the country's trying to do for opioid addiction. The VA has been tackling opioid addiction, which is part of accidental death and often related to suicide, for years, it has a model program that actually measurably has decreased opiates given, which is the gold standard now for preventing death by opioid. That's still way above the community for the most part, although I don't know, we'll need data from RTI about that. So jumping in, then we had Laura McCarthy. So Laura spoke about this project with the Visit 19 Meyer, almost lost that entirely right. And also WICHE, the Western Interstate Consortium on Health Education, a group that was created because 5 northwestern states, only one of them had a medical school. And so they had to figure out, how do we do the things that medical schools do for states that don't have medical schools? Continue education, you know, kind of helping rural people, rural doctors and other providers know how to do this stuff. And they created this consortium, which is now almost has a nationwide reach. And it's in Carteret County, and it may soon be in the Hampton Roads, the northeast corner of our state, connecting with the Hampton VA, which reaches into North Carolina, and create these things. And it involves everything we're talking about: homelessness. You get me where I'm wrong here. Homelessness, health care, employment, family support, education opportunities. Because if you really want to get suicide, you have to get at all those things. And those were different turf areas. And I'll mention one other thing that came up because I kept bringing it up, and I've got the microphone. And that is that it's great to have all these organizations doing all these things. And in the VA, we were very proud of what we can do, and always like, well, what do you mean we can't do that? But of course we dealt with the VA. Well, the fact is, and it took me years working in the VA to realize this, there are roughly 20 million living American veterans. Only 6 million use the VA any given year. Only 9 million are enrolled for care. That means over half of veterans, and really more like 2/3 of veterans, are not in our care. I mentioned the 14 out of 20 are not in VA care. We could be the best program in the world, and actually we are the best mental health, integrated mental health program in the world. I will bet money on that if anybody can prove otherwise. But we're never going to be big enough or good enough to do this job, especially for the 14 that are not in our program. So how do we move beyond all of our programs and get around people's kitchen tables? This is a specialist. You're certified in the state program, and this group helps support that program and help grow it. And I got my consciousness raised, thank goodness. And you have to have a lived experience of being mentally ill and be a veteran. So now you're a veteran care specialist. The VA has hired over 1,100 of these folks. We've got them everywhere, but not nearly enough. They're in mental health, primary care settings, and hopefully in some home settings by now. And of course the vets, but if you set up a place that isn't in the VA medical center, you have to get past the bricks and mortars, used to say, put it in the storefront, hire combat veterans. To this day, it's 60% veterans serving in the vet center. And, you know, no ties, no suits. It's not medical, there's no medical record. As a matter of fact, even VA doctors can't read what's written in the vet center, but they can read the VA doctor's stuff. If they need to have that, they can get that instantly. It's a remarkable program that reaches out at a peer level. And then Moses Gloria is here, who is one of the OEF, OIF veterans, the GWAT outreach workers, Global War and Terror outreach workers that were hired simply on the basis of having the lived experience of serving the war and wanting to do this. And what's really great about this is, you know, Vietnam veterans are my age and a little bit older. And 20 years ago, there was real concern, what are we going to do with the vet center when all the Vietnam veterans are retired? And they were retiring at a fast clip. Well, thanks to people like Moses, we're going to have leadership into the next, well, into the end of the century, I'd like to say, in the vet center. And people who are also really want to challenge people to think about the programs you have. People are always saying, I don't know anymore, eat 5 servings of vegetables every day. You know, whatever it is, they keep telling us that. And I know I don't eat 5 servings of vegetables every day. But if my wife said, I'm serving you 5 servings of vegetables every day, I'd be eating the vegetables. You know, how do we get into people's homes and connect with them in the terms they want to be connected in? That is a terrible summary of today.
No.
My apologies.
Secretary Kinsley has another appointment to make. He's got 9 hospitals he manages, and I'm sure you'll give him a pass. But to Dr. Cudler's point, the main findings out of all of these events that we were talking about this morning, all of these initiatives going on in North Carolina, is better communications in the communities. It is building effective community groups between organizations, and somehow nobody takes credit, everybody wins. And that seems to be a recurring theme in all of the conversations we had this morning. So with that, I would like to then invite up to the podium Ann Gasparini, who is here talking about the North Carolina National Guard suicide prevention initiatives. When we talk about community and we talk about folks who need our help, right, the Guard's stretched out all over across the state. They don't have bases. They get together a weekend a month, and usually it's something horrible, like a hurricane or tornadoes or something on top of it. So Ann's going to tell us about what the Guard is doing to keep our Guardsmen safe and here for us.
Good afternoon. Can everyone hear me okay? I'm short, sorry. I am the Suicide Prevention Program Manager for the state of North Carolina for the National Guard, and I'm going to brief you on what I do within the Guard in order to prevent suicide. Now, just a little history on, I don't know, I'm just speaking today. A little history, many of you are aware of the fact that 20 veterans per day are completing suicide, which totals about 1 every 72 minutes, or 7,300 veterans per year. Now, the Army has the highest proportional number of suicides compared to any other service. And in 2012, the number of soldiers who died by suicide exceeded the number of combat-related fatalities. And due to this spike, the Army implemented some programs in order to address the situation. Out of that, the Community Health Promotion Council, it's called the CHPIC, was created, and within this model, they chose to focus on enhancing the suicide prevention program and the Master Resilience program. They hope to prevent suicide through education and comprehensive soldier fitness, addressing those mitigating factors that impact soldier performance and family. It was important that they brought the family into focus when they noticed the situation that was occurring within the Guard. Now, this embodied the total health promotion of a soldier to include emotional, social, physical, spiritual, and family aspects. Now, out of the 3 Army components that include the active duty component, reserve, and National Guard, the National Guard had the highest rate of suicides. So, part of my job to attack this statistic is to ensure that the annual prevention training is being conducted and that those requirements are being met every year. So we need to make sure that our soldiers are receiving the ACE, or Ask, Care, Escort training. And they are also receiving our ACE-SI, which is a suicide intervention model. Now, just recently, the ACE format has been reworked. And so I'm looking forward to getting the new ACE model so that we can get that out into our Guard units. I also help with training the Applied Suicide Intervention Skills Training, or ASSIST. And I also do targeted prevention training with the units at the unit level upon their request. And this engages the soldiers in direct discussions about suicide awareness and prevention, and it gets them involved. So they are sharing their knowledge with me with just a little steering. But our hope is to get these educated and trained soldiers within the unit so that we're not only coming from the top down, but from within to address suicide concerns. I maintain community relationships with organizations and participate with groups like the Governor's Council. Sorry, I lost my thing. I complete also the Department of Defense suicide event reports, or the DOTSERs. A lot of you may be familiar with that. And these are done for each confirmed Guard suicide. The data is submitted in order to understand the mitigating factors and the trends that contributed to the suicides. And this is done across the services so that we can extrapolate data from that and know where to focus our efforts. So there are many ways that I do reach out to the soldiers. And I know Jeff hinted at the life of a Guard soldier or a citizen soldier, and it is very unique. They come together one weekend a month or for 2 days, 12 months out of the year, and that is how they serve. However, National Guard soldiers also do deploy, and a Guard deployment is usually about 9 months. With these deployments, reintegration is a unique process. It's not like the active duty side where they're still within that community and there are a lot of supports around them. They come back and then go right back to their civilian lives. There's not a transition period. There's not a time or a lot of benefits that are being thrown their way because a lot of these rural communities, that's not available. So in an effort to try and provide some additional resources, the Yellow Ribbon Program and subsequently the Beyond the Yellow Ribbon Program will form, and many National Guard programs are funded through the Yellow Ribbons. They are to address all 3 areas of the deployment cycle, from pre-deployment, deployment, and reintegration. And I do go to the reintegration briefs and speak about suicide risk factors, protective factors, and warning signs. Just trying to plant that seed so they know what to be aware of if they recognize that within themselves or within their battle buddy or even family members, because we all know deployment is stressful. So within the Guard, the CHPIC, or that Community Health Promotion Council, has kind of transitioned into what we call the Commanders Ready and Resilient Council. And we abbreviate that because we love our acronyms to CR2C. I do sit on that board, and the council is actually a senior leadership board that oversees the 5 working groups that promote the 5 pillars of readiness. And those are the emotional, social, physical, spiritual, and family sides. We also have representatives from each major subordinate command so that we can discuss the best practices and what challenges are occurring within the force. We do meet quarterly, and our ultimate goal is to acknowledge that suicide is just not related to deployments or to military service, but it can actually be a daily struggle for many just living their civilian lifestyle. So the National Guard is committed to promoting the overall well-being of our soldiers through suicide prevention, education, intervention, and also building resiliency. And that's why we partner with our community partners to do the best we can for our soldiers. Thank you.
All right, so now I would like to invite our friend Jeff Doyle. We'll call him a friend of the program because he truly has been a friend of the program since he arrived in North Carolina, what was it, 8 years ago now?
Yeah.
So in the last 8 years, Jeff has been instrumental in helping us reduce veterans homelessness and begin forming a statewide working group on reducing veteran suicide. So I'd like you all to give him a warm round of applause because tomorrow is his last day with us. He'll be moving on. Give him a listen, and let's hear some thoughts learned on how we changed the landscape in North Carolina.
All right, so first I'm going to apologize in classic fashion. I knew I was presenting today on Tuesday, so I can put together slides for everybody. I guess the thing that I really would like to start with is from the presentations from this morning. We heard about the Mecklenburg area SAMHSA VA initiative that's going on, and then we also heard about the Carteret County pilot project that's happening. I wish we could have gotten up here before all of the chairs left, but I think that the main thing that I want to really stress to everybody is that this is an opportunity that we have. I said that this morning, but for those of you who weren't here this morning, I hope that we can take actions in North Carolina on this. You know, we've made significant strides in addressing homelessness. That came a lot from the work from this group. You know, we created a subcommittee that then was able to do training across the state, duplicate what Mecklenburg did on homelessness. Similar to the Suicide Prevention Initiative, they did an initiative called Community Solutions that looked at really what the national VA ended up copying. It looked at creating these binding lists, targeting resources, having the VA get out of its box and be just another member around a table and sharing resources, and not just sharing the resources, but sharing how those resources were distributed, not being the sole owner of those resources. And this is really an opportunity to copy that. You know, we can take what is going on in Mecklenburg, learn what that process is, and then duplicate it. And the reason why it's a challenge and why it's important to have the chairs here is that we need champions to take that on, because, you know, Mecklenburg is one of 30 cities in the nation right now doing this. The Carteret Initiative is 4 or 5 counties in the nation doing it, and so moving forward, you know, I really hope that the Suicide Prevention Subcommittee continues to meet here. I think having report outs, much like the way we've been doing in homeless, has been taking place, so that everybody knows the progress that's being made, and at the same time, if there are providers or other agencies in the community, whether nonprofit, other state agencies, other federal agencies pulling in like we have with HUD and SAMHSA and all of the different ones there, how can they get involved and continue to push the issue forward? So I didn't have slides, but really I just want to put that on all of you. Don't let this opportunity get wasted. Move forward with it and hold the people up here at the front responsible if you don't hear about it on a regular basis. Amen. Thank you, John.
Coming back, is she coming back next month? Yes, so she's coming back for the month of May, Dr. Keita Franklin. In June, we have a former member of the working group co-chairs, Cheryl Rawls from the Vero, will be coming back because she's now running the VA Central Office, Office of Transition. You know, this is a great opportunity for us to get information from both directions, above and below, on how to change lives and save them. And with that, I would like to introduce our friend John Camp from Campsite Strategies. He has been working with us for the last year to do a number of veterans pilot programs on suicide reduction and prevention, interviewing North Carolina veterans. So he does a much better job at this than I do. I'll let him have it.
Well, thanks, Jeff. Which is our forward, that guy, right?
Yeah, yes, sir.
Thanks. The folks who really deserve pretty much all the credit for making this happen are in the back of the room, and isn't that always how it happens, right? The folks who deserve the credit somewhere back there. Alex and Amy, a ton of help by them. So basically, this concept was born from the Words to Live By campaign. The number of you today in this room have taken part, and thank you very much for contributing to that. Words to Live By is a series of short videos that went out on social media and continue to, veterans talking to other veterans about suicide and about helping themselves and each other up as they go along. Out of that and of the content we were creating for that came this idea, and this was a new way of helping veterans get all of the information they need when they're in a point of crisis in their life with one click, with one stop. And there are a ton of websites out there, but Help NC Vets, we created this website and concept, which has now evolved into its own hashtag. Hopefully you might start seeing Help NC Vets, hashtag Help NC Vets across social media platform. And then it evolved into what we are thinking of as a beta campaign for a market saturating pro-veteran, anti-suicide message to go out in the Raleigh-Durham market first. And what we did was we took some money from DHHS and took some money from the Governor's Institute. It wasn't much. Really, it was, I don't want to give too much away. I'll just say it's about $5,000. It really was not much money. And we were able to start a campaign on television, on the radio, on the internet for this amount of money that went wide is a wonderful way to put it. On the radio, you can see the number of people reached down below. We had different spots that went out on the radio. This is on the internet. And what we discovered on the internet and in the metrics that were later revealed from this campaign was that an average click-through rate, for instance, is 0.04. Ours was 0.30. That reveals a remarkable need for the kind of information that we were putting out there to folks. People were taking advantage of our banner ads, of our services, and spending time on our page in a way that was unfortunately revealing of the circumstance that you all are in this room trying to deal with right now. On television, we partnered with ABC 11 for this small campaign, this beta campaign, and I think we spent $2,500 only with them, and reached 5 million people. 4.5 million households, 5 million people saw these small ads that we put out over the Christmas holidays, this recent Christmas round. And what's most impressive about all of this is that it's replicatable with ease. What we demonstrated with this small beta campaign is that with a very small investment and a commitment and a plan, you can get issues that are important like this out in front of the population out there, and that they can and will take advantage of those services. We went out there to see if that was the case. That's why it was a beta campaign. We were dismayed at what we found. The kind of response we found was overwhelming. And so now we're out there trying to solicit money from any groups that have it. No. Specifically, we're trying to drum up some money from in a corporate campaign. Maybe get some large corporations to fund something in a bigger scale. Sustainable campaigning like this. Anyway, we wanted to let you know this is what's happening out there and that it's going on. Be on the lookout for this sort of thing. And as you think about telling your own stories and integrating with either your local media or just trying to get out on social media, think about Help NC Vets if you would, and either co-branding with us or bringing us into your campaigns. And if you need help telling your story, well, that's what these guys have brought us in for, as kind of, I don't think we're necessarily to serve all of you but having said that, we're definitely here to listen and to help. One thing I'll quickly say, we sat in on the mini pick as well. One of the things that came out from that meeting was how many remarkable stories, good news stories of success and survival are out there, perseverance. These are stories that are the best kind to tell and never get told because we don't think about telling them. I was in news for 20 years, and the common critique in news is we don't bother approaching the news because they only want bad stories. They only do bad news stories, and that's the wrong way of thinking about it. You just have to present good news in the right way. And so if you have some good news stories and you think maybe this could catch the media's attention, we're here to help you get through that. I want to throw ourselves out there as a great place you can bounce ideas off as ways to maybe catch your good news and success stories and push those out again, because that will also help turn this. We heard a lot about person-to-person contact this morning. It's also true that just these bigger ideas need to be out there in the populace as well, and we can help with that as we've shown with this small campaign. Thanks, Jeff.
Thank you, sir. All right, and now the moment you've all been waiting for, Sergeant Major Barry and the NC Serves updates.
Hoorah! Hoorah! I don't do slides today for the sake of time.
Well, there is one.
Yeah, there is. Probably. Again, thank you for this opportunity to speak. I need to remind everyone, when you leave, the table where you signed in, there's the newsletter from Business 6, and I've got some things out there. I'm not trying to sell you NC Serves, but this room gets this information. You already get it. Get it to the people who don't know, okay? So please do that. A couple quick notes here. I can't from the bottom of my heart, thank Department of Health and Human Services enough for stepping up in a leadership role and saying that, we were going to support NC Serves. It means everything to me, and I can sleep a little bit better tonight knowing that. The VACs, I can't say enough about. There's that VAC that's kicking off down in Wilmington. We participate in all those VACs. Again, I will always back it up. And Colonel, that event down there with the Lumpy tribe, that was groundbreaking. That was it broke new ground. I walked away from there super motivated, saying that's the way it should be done. So I thank you for the opportunity that we could participate. We did talk about, we are very closely partnered now with the DVOP in Winston-Salem at a Goodwill. We just started that. It's on the NC Serve Central Carolina Facebook page at the same time. So I think that's new. Now that wasn't it, but that's you back there and a young lady named Margaret. So anyway, let's get down to the brass tacks of what matters. I want to give you some programmatic updates across all the networks in the state. Let's talk Western out here. Brandon Wilson, he's probably doing something now that probably concerns me, if you know Brandon. But he's just done the QPR training, doing really well. He conducted 3 trainings in 3 counties with over 50 individuals. I talked to him yesterday on the phone and said, "Hey, Brandon, is it mattering? Is it working?" He said, "Absolutely, because it's getting the information to the right people." And that's what's mattering. So we're going to work that too, but he's working on that. If you don't know it, Brandon and his team is on the radio every first Thursday of the month. And it works. I kind of spied on him. And for that area in the mountains, it really does work. It's, again, it's just this different approach to what works. And at first, I even kind of chuckled. I'm his peer. I'm like, I don't know, man, radio? Anybody listen to radio anymore except for music? And he's like, it's working. I was like, absolutely. If it saves one life or changes a life, I'm all for it. Amen. His peer support specialist, Ricky Johnson, I have met and know his story, but he got an award for a Empowering Hope Award presented to him recently down in Wilmington. That is good stuff. I have only talked to him once in person, and it helped me. Hearing his story and then him talking to me, it really mattered. Brandon's got a formal partnership with Duke Life Point Hospital. He put a kiosk in there. It kind of works up there in the mountains because everything's vertical. And it takes you 2 hours to get 10 miles, but it's working. So again, it's another way of how are we reaching. The Metrolina Network and VDH, they're represented in this room, but I can't say enough that mayor's challenge and how they're just crushing it, literally crushing suicide. That's what you got to do. You got to stomp it out like an old cigarette butt. But this Sunday, Patrick, their network director, I'm going to be with him. He set it up. The North Carolina Elks district meetings in Winston-Salem. I think there's a lot of potential there. Patrick's dragging me along. I'm kind of in the back. Blake, I'll do whatever he needs me to do, take notes or whatever, but I think there's a huge opportunity there because they're stepping forward. So I'm just there in a supporting role of whatever Patrick needs. Their mental health first aid training, and then this morning with Dr. French and the rest of the team on taking that glossy right up here. Heather's busy right away from day one. We moved Rebecca Swain from Winston-Salem over to what's called a community of practice assistant position, help me community of practice stuff across the state. Again, so it's going after silos, it's partnerships, it's collaborations, it's all that every day, all day. We're doing RNC Strive in our area at NC State on June 6th. I'm actually going to be on a panel there, and we're going to participate. On the 1st, we're speaking at the Disability Rights of North Carolina, their annual meeting. That's going to be a good one right there. I think a lot of that came about from the response to the hurricane and how we kind of really realized we're kind of doing the same thing here. And we've really lined up with that. And I could get on a soapbox of what I want about like emergency management, National Guard, with NC Serves. And because of, unfortunately, because of Hurricane Florence, it opened up all these partnerships that I don't think ever would have happened because we're just too busy. We pass each other on 540 going like this at 3 miles an hour. But it never would have happened. And now we have working groups that we have formed that are changing the landscape of how we support our disabled veterans and our disabled population across the state. So I can't say enough about that. And then on May 4th, Congressman Mark Walker is having a resource fair out in Greensboro. That was extremely popular last year. It is every time. I think a lot of rural veterans show up. I asked them, where are you coming from, sir, ma'am? I'm coming from a place, and I had to Google it because I never heard of it. So it's north of 40, I would say, and that's important that they're coming down for the resource and talking to a VSO, maybe face-to-face, one-on-one or in the back, and say, hey, can I talk to you for a minute? And that's going to change or save a life. I guarantee it will. The Coastal Network, they added a staff member in Wilmington. So they have a community coordinator in Wilmington now, Ed. They got a steal on him, immensely talented. Talked to him once on the phone. They're crushing it in Wilmington already in a good way. Partnerships, collaborations, we're reaching all the way out to the west, to Robeson County, the Lumbee Tribe, and connecting these networks like they're supposed to be, so great things are happening. They're working with the police department in Jacksonville, again, high veteran population. We are doing the same in Central with the Fayetteville Police Department and what's called a re-entry council. It's a new concept that it's new to us. They've been doing it. They're just plugging NC Serves into it now. So it's kind of like it's not a veterans treatment court, but it's the same principle. And boy, does it work. Because now you're taking this veteran who served in combat, who may have been in jail overnight or may have been in jail over the weekend, and you're connecting them to something so they can gain their honor and their dignity back and not get down in the rut and just drink themselves to death or kill themselves with pills. They can get connected to something and say, hey buddy, come here. We're going to make you better. We're going to find a way to make you better. They got military one source. When you're guys like you, we're going to make you better. And you're engaging Key City and the base leadership down there. Got some good stuff going. I wish my partner Jarek was here. I'm sure he's out doing way better work than I am. But they're really crushing it in Onslow County, Jacksonville, and that eastern North Carolina area. And the work that like Laura's doing and tying it all together with the leadership of the commands, the base, the veterans groups down there. I come from there. That was my tribe for 30 years. And the potential there to kind of gel it all together, they're almost right there. And I think they're going to go over the hump this year in 2019 and just crush it. One note on community of practice, as in the whole state. Northeast North Carolina, Elizabeth City, high Coast Guard population. Anytime they would see me, they would put me in the corner as a former Marine, and they'd go, we don't have NC Serve support in Northeast North Carolina. Well, now you do, because United Way Southampton Roads, Virginia is now an American Serves provider. They cover 10 counties in Northeast North Carolina, including Elizabeth City. So where Jeff Smith's at, it's now 54 counties, not 64 counties. 74 counties covered. And one last thing on county veteran service officers, and I'm going to tell you about the difference. And I won't necessarily use data because I didn't bring it. Franklin County, Granville, and Vance County, north of here. Anybody been there know about it? There's a resource desert up there once you get up there. Those veteran service officers collectively came together, contacted me, joined this network. They're technically not on my map. Yet those 3 counties that are technically not in NC Serve's coverage area, in February sent the most amount of referrals into the network because there's a desert up there of resources. And that VSO is in a one-person fighting hole sometimes, and they're out of ammunition sometimes, and their canteens are empty, and they need resources. So I think it's just the tip of the iceberg of the potential of bringing this together with the VSOs, the DVOPs. We have big pockets now of success. A year ago, it was small pockets. Now it's big, and I think it's all really starting to come together. The last thing is a statement from the bottom of my heart. If I had to go to anywhere to find people to solve veterans' problems, I wouldn't have to leave this room. Everybody who needs to solve our problems is in this room, I promise you. I've been a lot of places, done a lot of things in life. Do whatever you do, do it well and do it right, and just do your best, and it's going to be fine. It really is. The other states are envious of what's going on here. I promise you, they don't know how to do this. They don't. They fight, they bicker, we collaborate. So ladies and gentlemen, thank you.
Apparently I'm back in charge.
Moses back in charge.
So I'm going to be closing you guys out today. First and foremost, our next meeting is going to be May the 23rd, Preventing and Reducing Veteran Suicide, Session 2. These meetings are going to be conducted at the Situation Room at Joint Force Headquarters, this time in Raleigh. Right now, we're going to be going through introductions. We don't have a mic, so